Thanks very much, Anne-Marie, for that kind introduction. And I'm so honored to be with you for the next 42-ish minutes or so with four amazing individuals that I'm going to introduce. Before I start, I'd also like to let the panel know how much we deeply appreciate that they are about to graciously and openly share experiences with the audience today, likely that they never thought they would have lived through. And I know that this is likely not a fun experience. And so again, I just like to express my sincere appreciation for the vulnerable position that they're going to and willing to put themselves in today. So without further ado, I'm going to introduce the first panel member who's going to speak, and that's Andrew Hare. Andrew is coming to you today from Waterloo, Ontario. And Andrew is a happily married husband with 2 young boys. And Andrew was diagnosed with colorectal cancer in his 20s, less than a decade ago. So I'm going to pass it over to Andrew. And after Andrew, we'll introduce and have the other panelist members share their experiences as well. So Andrew, over to you.
Andrew, you're muted.
Sorry about that. I guess I was muted. Thanks, Don. Hello, my name is Andrew Hare. Today I am 39 years old. I have been married to my wonderful wife for almost 12 years, and we have 2 amazing sons, 3 and 5 years old. 10 years ago, shortly after my 29th birthday, I received a devastating diagnosis. I had stage 4 colorectal cancer. The diagnosis was a shock to me and my family. Like many people, I had always thought of colorectal cancer as an older person's disease. I had no idea that it could affect people my age. For this reason, I am honored to participate in CRAN's Early Age Onset Colorectal Cancer Virtual Symposium today. I hope that my story and the stories of my fellow panelists will put a greater spotlight on early age onset colorectal cancer and lead to earlier diagnosis in younger patients. My colorectal cancer journey officially began in 2011. I was a healthy 29-year-old. I was a newlywed, starting out my career, pursuing professional designations, and looking forward to traveling and starting a family with my wife. Looking back on it all now, I realize that I experienced symptoms of colorectal cancer for a few years prior to my diagnosis. The symptoms ranged from diarrhea, changes in stool, to tiredness. These changes were gradual, and I explained them away. I was tired because I was busy. I must have eaten something that did not agree with me, etc. It was not until I started experiencing severe abdominal pain and persistent diarrhea that I decided to visit my family doctor. That first visit got me a blood test and a referral to a gastroenterologist. The blood test did not show any irregularities, and it took 5 months to get in to see the gastroenterologist. Neither my family doctor or I were too worried at this point. My symptoms were most likely due to irritable bowel syndrome or colitis. The gastroenterologist wanted to do a colonoscopy, which took another 6 weeks to schedule. During that time, my symptoms got progressively worse. Still, I had convinced myself that I had colitis and was waiting for the colonoscopy to confirm that. Immediately after my colonoscopy, the gastroenterologist told me that he had found a tumor and he was positive that it was cancerous. I was in shock. The thought of having cancer had never crossed my mind. The next few weeks were a blur, with appointments and tests. I had a CT scan which found another mass on my liver and confirmed my stage 4 diagnosis. I was referred to our local cancer center, started chemo and radiation immediately. The treatments were hard on my body, and I ended up in the hospital for 2 weeks. My digestive system was severely affected, and I relied on an IV for nutrition. My surgery was postponed until I was stronger. I finally had surgery to remove the primary and liver mass. I spent another 2 weeks in the hospital. After I recovered from the surgery, I did another 6 months of chemo, after which I was declared no evidence of disease. A year later, a small mass was discovered on my lung. I had surgery to have it removed, followed by more chemo. A year and a half after that, 2 masses were found on my lungs. I had another surgery, followed by more chemo. That was in 2015. I have been no evidence of disease since then, but I get anxious and nervous every time my regular scans approach. I am doing well now, but I am hesitant to say I am a success story from scan to scan, and I know the cancer could come back. I am so thankful to be alive. I know that many others with the same diagnosis did not make it or have had a much more difficult time. I have a number of issues as a result of all the surgeries and treatments I have gone through. I experienced recurring infections and chronic pain from one of my surgeries. I still experience neuropathy in my hands and feet. My cancer journey has also had a significant impact on me mentally. I am not the same person I used to be. I think it is important to discuss the different issues that younger people face when diagnosed with the disease. As we all know, colorectal cancer is widely considered an older person's disease. It was nearly impossible to find anyone my age going through the same thing. My wife and I tried to reach out to others for support, but there was always a significant age gap. We were always the youngest people at any appointments, meeting, or support groups. It was difficult to relate to others because we were at a completely different stage in our lives. We had gotten married a year and a half ago and were planning to start a family. Chemo and radiation can affect fertility. While the shock of this diagnosis was still fresh, we had to quickly make some family planning decisions. We are so fortunate to have been blessed with 2 healthy children after my treatments. Younger people may be hesitant to discuss their symptoms with anyone because of embarrassment. It is too easy to explain away any symptoms as irritable bowel syndrome, Crohn's, colitis, or other digestive disorders. They may think that they just need to improve their diet, exercise more, get more rest, or take probiotics or vitamins. Younger people need to advocate for their own health and demand that the appropriate tests be done. Healthcare practitioners need to listen to their patient, ask questions, and refer them for the appropriate tests. We need to work together to increase awareness of early age onset colorectal cancer so that earlier diagnosis can be made. Earlier diagnosis is the best chance of survival. I hope that my story will help even just one person get an earlier intervention. Everyone needs to come together and realize age is just a number, and colorectal cancer does not discriminate based on age. Thank you.
Thanks very much, Andrew. I know I only met you very recently, but I too am so thankful that you're here with us today. So next up, I would like to introduce Armina Lagaya. Armina is a stage 3 colorectal cancer survivor, and she was diagnosed while she was pregnant and experiencing what she and her physician thought were pregnancy-related symptoms. Armina lives in Toronto with her husband and her now 6-year-old daughter, Olivia, I believe it is. And
That's right.
She really credits her daughter for leading her to take her symptoms seriously. So Armina, over to you for a few minutes.
Thanks so much, Dawn. I was diagnosed with stage 3 colorectal cancer when I was 35, and it was the last thing that I had expected. My husband and I had just bought a house. My career was progressing, and as Dawn mentioned, we were expecting our first child. You know, everything was going seemingly smoothly. But when I started feeling localized pain, I thought it was pregnancy related, and so did my family doctor, and so did my midwife. Hemorrhoids are common during pregnancy after all, and it was the logical conclusion. But the medication they gave me didn't help, and the pain intensified so much that I went to a walk-in clinic and ended up getting an ultrasound. Meanwhile, my midwife referred me to an OBGYN as a precaution, and when those results did come back, my obstetrician said the word I didn't expect. No one really expects to hear, but I definitely didn't expect to hear. Cancer, stage 3 colorectal cancer. I was, and my husband was, we were just in complete shock. And that moment, I remember it was a really, really cold, late December day, kicked off a whirlwind of tests, doctor's appointments, hospital visits. And that meant that I ended up getting an emergency C-section to deliver my daughter at just 32 weeks in January 2015. She was a teeny preemie at 3 pounds, 11 ounces, and it broke my heart to deliver her so soon. But my doctors assured me that she would be okay and that it was absolutely necessary. Without her early birth, I wasn't able to get a CT scan, and I needed to also give birth early in order to start my treatment. So I underwent an aggressive course of treatment of radiation, surgery, chemotherapy, all while taking care of at the same time a newborn baby girl. It was a difficult time, to say the least, for obvious reasons, but also that I was dealing with what I too thought was an old person's disease, and I couldn't find anyone who was my age who understood or was going through the same thing. But that is until my husband found CRAN, and we met Philomena, and she advised us, gave us some guidance, but also connected us with other young patients who I could relate to and learn from as well. And with the help of my wonderful doctors at Sunnybrook Hospital, support from my husband, family and friends, and CRAN, I am doing much better now. There's no longer any evidence of disease for me. I'm back to work from home, obviously these days, and our daughter Olivia is now going into grade 1 and is actually pretty tall for her age, so she's no longer teeny. Really, it is Olivia who saved me. I think it was definitely pregnancy that put pressure on the tumor that must have been growing there for years, which allowed me to discover it. But other patients, including a good friend of mine who passed away 2 years ago, catch it too late. So that's why I'm here telling my story. I hope that, by telling my story, that when a young person presents with symptoms that could point to this disease, that healthcare professionals, as well as patients, give it a second thought before making the logical conclusion. I hope that by telling my story, we can raise awareness and hopefully save some lives. Thank you.
Thanks so much, Armina. And talk about smashing stereotypes today related with people who've been diagnosed with colorectal cancer. I think, Armina, you are right up there with the rest of the panel. Next, I'm going to introduce Bill McGinley, and Bill lives in Toronto. He was originally diagnosed with stage 3 colorectal cancer 13 years ago when he was 40, and he lived with no evidence of disease for the next 10 years. However, his cancer then returned as stage 4 with metastases in his lungs and retroperitoneum. And he's currently, though, being treated with chemo and doing really well. So we're so glad to hear that, Bill. And he is happily married to Kim and the proud father of 4 great kids. So Bill, we're going to hand it over to you next.
Thank you for that. So I was originally diagnosed with stage 3 colorectal cancer at age 40. I was very fortunate that after a year of treatment, comprising of a month of radiation and chemo, followed by surgery, and then some more chemotherapy, I was NED for 10 years. Unfortunately, in January 2018, at the age of 50, as a result of routine annual testing, I discovered that my cancer had returned, this time as stage 4, with early metastases in my lungs and my retroperitoneum. Thinking back on my first diagnosis, I was a busy husband and father, with 4 little munchkins that included a baby. I was the president of an Ontario-based trucking company, of which I owned a third. I was keeping fit, running 4 to 5 times a week, and going to the gym often. I remember the first time I had trouble in the bathroom and blood in my stool and the toilet. Being a busy guy, in my own head, I dismissed it as something I ate or drank. I continued to do this for about 3 months until I made an appointment with my family doctor. When I saw the doctor, we had a good discussion, but I think the discussion between us was one aimed at a young, busy guy, and I think I have equal responsibility to bear for how our initial discussions went. The doctor did examine me, and he did ask many good questions, but I think because I was young and in good shape, together we landed on all kinds of reasons for my bathroom troubles that did not include colon cancer. At the end of my first consultation with the doctor, he prescribed Tagamet and told me to call him if I continued to have problems. After another 3 months passed, I was still having problems, and I did call him. This time around, he ordered a colonoscopy. This is something I should have done right away, but my business was very busy, and I was trying to sell it. So work was go, go, go. And at home, it wasn't any less busy. The kids were all in swimming lessons, and the 3 older kids were all playing hockey. So there was no rest and no time for anything. And I was young and foolish and had a "it can't be me because I'm young" attitude. As a result of my poorly informed attitude, and I guess no follow-up from the doctor to say, "Hey, how come you haven't gone for your colonoscopy yet?" It took me about a year and a lot more trouble in the bathroom to find the time to take the test. Boy, do I wish I wasn't so stupid. Because I wasn't informed enough about colon cancer, because I was young and didn't believe it could be me, because colonoscopies weren't routine, because people in general don't talk about colorectal cancer and its symptoms, because. When the diagnosis came back that I had stage 3 colon cancer, it was the scariest thing I had ever heard. When I woke up in the recovery room at the Rudd Clinic in Toronto, I asked the doctor how I was, and he told me that I had cancer. When I asked him what I should do next, he gave me a Christian prayer card and told me to pray out loud over and over that I might be healed. I can tell you that while his actions were thoughtful, they weren't very reassuring, and until I was in the hands of my surgeon, I thought for sure I was going to die. However, once I was in the system, I received very good care, and as I have already mentioned, being NED for the next 10 years, I thought for sure I was cured. Unfortunately, 10 years later, whammo, just when I thought for certain that my cancer was in the rearview mirror, it reared its ugly head again. The discovery was a very dark time for me. We had just finished a major renovation on our home, my career was flying high, and life was going great. After a couple of days of tears and very brief meetings with doctors, with my head spinning, things finally started to come together. I met with my original oncologist, went through a bunch of testing and staging, and started chemotherapy. I have been on Fulfuri and Avastin for 3 years now, and I am doing very well. The metastases in my retroperitoneum are in remission, and the mets in my lungs have shrunk since my original diagnosis and are being managed. I would say that on my present journey, my cup continues to flow over, as I am thankful to be alive and doing well in the here and now. I am glad to be participating in today's symposium to bring forward education that young people might be tested earlier and be saved more often. And I am also passionate about helping other patients and caregivers in their journey through my involvement in CRAN, the Colorectal Cancer Research and Action Network.
Thanks very much, Bill. You brought up some great points about communication with your physician.
I'm next, so no noise.
and I hear Anna prepping herself, so that's great. Up next, we have Anna Betancourt. And Anna is originally from Portugal, born on the beautiful island of Madeira. She's an only child. She works for St. Joseph Media as a national marketing account manager. and she lives in Toronto with her partner, Gus, and their dog, Legs. And Anna has been through cancer previously with lymphoma and was diagnosed in June 2019 with stage 4 colorectal cancer when she was 46. Thankfully, Anna will tell of how she has been successfully treated with immunotherapy at Sunnybrook Hospital. So Anna, I will pass it over to you to round out the experience sharing before we move into a discussion.
Thank you so much, Dawn, for the great introduction, and good afternoon, everyone. Well, good afternoon or good morning to where you're at. So yes, I'm Anna. I'm currently 48, and yes, I reside in Toronto. I will begin by taking a little bit of a page from what Bill was saying. When I was diagnosed, my life was very busy with a full-time career, and we were also undergoing a large renovation of our home. Cancer was not on my mind at all. It began early 2019 with stomach pains. I thought it was because of stress about work, stress with renovation, but finally, after some weeks went by and continuing feeling these pains, I went to my doctor. And interesting enough, the control freak that I am, I told my doctor what was wrong with me. I told her that I was stressed and that I wasn't eating clean, and that's why my stomach hurt. And unfortunately, she agreed and told me just to take some over-the-counter probiotics and let me know how things went. Well, weeks later in June, actually 2 years ago this week, I was taken to the emergency room with stomach pains, diarrhea, and vomiting that was just black. After a lot of tests, to my surprise, I was unfortunately diagnosed with stage 4 colon cancer, and it had metastasized to my liver and my peritoneum. I had developed the rare MSI-high mutation. My tumor, which was removed, measured approximately 14 centimeters. That's about the size of a grapefruit. The tumor was estimated to be at least 8 to 10 years old. I've been walking around with this for that long. Cancer wasn't new to me. In 1999, I was successfully treated for non-Hodgkin's lymphoma, stage 2. So, with a lot of talks with my doctor, when I turned 40, we planned bi-yearly breast screening. I've been doing them for years, but at no time, at no point, did we ever discuss adding colonoscopy to my screenings. And I didn't know to ask. I thought colon cancer, as everybody else mentioned here, was something old men got. I don't even know where I got this idea from. So remember, given the grapefruit size of my tumor, it had probably started growing in my mid-30s. If I had been screened alongside my scheduled breast exams, my cancer would have been detected earlier and wouldn't have been so advanced. I wish somebody had just told me to go get a colonoscopy. Thankfully, with the help of CRAN, my care was brought to Sunnybrook Odette Center, Cancer Center, where I started 9 rounds of chemotherapy. But my scans weren't good. But once an immunotherapy trial was available, my oncologist made the switch instantly. And within 2 rounds, I started feeling better. My scans showed amazing improvements with everything shrinking. 5 rounds later, I'm excited to say I'm now under surveillance for a year, and my cancer is all under control. Immunotherapy pembrolizumab has been a godsend and needs to be included as a standard care where applicable. I feel very grateful and very lucky that my treatments worked so well. Looking back, I wish I was more informed, like everyone else had shared. So now I tell everyone, even my Uber driver from last week, I told them all about early screening and my story. Basically, I want my story to educate others, to save lives. I see my cancer as a gift to helping others. Thank you so much.
Thanks very much, Anna. A couple of things that really hit me from your experiences are the idea of clinical trials being an option for people. That's a topic near and dear to my heart. And then I love how you're one person at a time, one Uber driver at a time, you're trying to help inform people about this. So thanks, everyone. As I mentioned at the start, I really appreciate all of what you've shared here. I know it's deeply personal, and I know each one of you is doing this because you want to help others. So we've got about 15 or so minutes for a bit of a discussion. And I know, Anne-Marie, you're watching the questions, and I would like to invite the audience, if you do have questions, please type them in, and Anne-Marie can bring them to the panel. I think we're going to start out by touching on a few things that I know came up throughout your discussions, but we're going to focus on them a bit so we can kind of highlight them for the audience. So one thing that struck me throughout our conversations, and just to let the audience know, we got to know each other a bit before we came together here, and so we've had various discussions as a group. But you've all, quote, beat the odds. You're all here today joining us. And you've done that partly because a lot of self-advocacy and perseverance. So we heard from each and every one of you, multiple visits to your healthcare providers, trying to put different pieces of the puzzle together, sometimes yourself not even, knowing what these symptoms may be or dismissing them. And I know that hindsight's always 20/20, but my question for you here is, when you do look back, what would you like to impart on other potentially patients in the audience and others about your experience in terms of advocating for yourself and the importance of that, and kind of some tips that you have for other people to do that? And maybe I'll start off with you, Armina, if you're willing to take a first go at it here.
Absolutely. In terms of, in my case, it took another visit to a walk-in clinic, not one of my actual doctors, to get an ultrasound and eventually, get to my diagnosis. And I think, in terms of, advocating for yourself, I find that that's really important. And I think I really learned that, particularly, connecting with CCRAN, to just be able to educate yourself and ask more questions and try to just seek out different answers and seek out different avenues. And I found that it was very important to do so, even in the course of my treatment, to see other options. And particularly in my case, because, I was not the typical patient. And so I think it's a system that was sort of built for what was the typical patient. And so for me, I had to ask more questions that were pertaining to my issue, sort of like, I'm pregnant. What does this mean? How do we approach this? What are my options? I think it's really, what I did learn is that it's really important to advocate for yourself, ask a lot of questions, and ultimately you don't know until you ask.
Thanks, Armina. Andrew, do you have any thoughts on this one? I know you've talked a lot about, you were young, you came up with all kinds of ways to rationalize away your symptoms. If you looked back on it, what would you do differently in terms of some of your self-advocacy and maybe your questions that you had for your healthcare provider at the time?
I think for me, the biggest thing looking back is that things change slowly. You experience it slowly. You need to know your body, and you need to understand that things are changing, and it's not just you're getting older, you're busier, you have more stress. It can be other things like colorectal cancer. And we need to make people aware that in your 20s, you can get colorectal cancer, in your 30s, in your 40s. And as much as we want to say to the doctors to, when someone comes in with these symptoms that you should know to send them for a colonoscopy and all that, the patient has to get there first. They have to make the appointment to see their family doctor, and you need to monitor yourself, right? If you start having issues in the bathroom that aren't just a one-off, once a year kind of thing, then you should go to your doctor and you need to ask the questions, and not just from WebMD and whatever, but actually ask yourself how this is not right, and get that help, and don't take no for an answer. Just keep going until someone will listen.
Thanks a lot, Andrew. Bill or Anna, anything else that you would like to add to that?
Yeah, sure. I would like to talk a little bit about progressing from seeing a GP to getting involved with an oncologist or other specialists. And what I would say is that once you realize that you do have cancer and it needs to be treated, I think it's so important as an individual to, as a patient, to start with the basics. Know the details of your cancer and your treatment. Where was your cancer? Where is it now? What medicine are you taking? What's your CEA? Prepare and how important it is to prepare questions for your oncologist before meeting with him or her. I think like really understanding the details of your cancer helps you navigate yourself through your journey and have a better, and results in you having a better outcome.
Thanks, Bill. Important messages there about being prepared, asking questions, making sure you understand what's going on. Anna, any last words from you on this topic?
Yeah, just quickly, as I said, I had a history of cancer 20 years prior, and we were doing everything we can in terms of breast exams and whatnot. And actually, in the meantime, my uncle died of colon cancer. And so I guess my what I want to say, and I tell everyone, is have a discussion with your family, with your physician about cancer, period. I think if we just kind of took, I took my foot off the pedal. I thought, I'm getting breast exams, I'm fine, I'm doing all that I need to do. But perhaps if a conversation had been, again, I had brought up the situation with my doctor, we would have added colonoscopy, but also just having that conversation with your family. I have on my mother's side, there's 11 children, and only after I was diagnosed did someone tell me that my uncle had died from colon cancer. So again, it's not something that people talk about within their family, of course, but just bringing it to the table and having that conversation with your network, it would really, really help. Again, if somebody had told me to get a colonoscopy before, I would have. So yeah, just more conversation.
Thanks, Anna. I think that's great advice. Anne Marie, do we have any questions coming in, or?
Yes, thank you so much for asking, Dawn. One specifically for Bill, and then one to the broader group. I'll ask the question that came directly for Bill. Bill, did your follow-up screening after your original diagnosis actually stop after 5 years, and hence the surprise re-diagnosis after 10 years?
So the standard of care is for 5 years. And then at the end of, actually, I was doing so well that at the end of the 4th year, my oncologist offered me to go to a different level of screening. So it was annual, but it was like an aftercare type screening. And so I was screened every year right up until my 10th year. So my primary care was transferred from Princess Margaret Hospital to Women's College Hospital, where they had follow-up by a doctor who was not an oncologist, but who had been working with oncologists, and it was just a different level of follow-up, but it did include CT scans. And that doctor, once she saw my my scans never showed anything until the 10th year. But when she saw my CEA rising and the last scan come back with some troubling news, I was able to get back to see my original oncologist at Princess Margaret Hospital very quickly. I believe fundamentally that if I wasn't going for aftercare after the 5-year mark, that I wouldn't be here now. So my cancer was caught very early stages, and my CEA was only at 12 at the time. And then I've had a remarkable response to my chemotherapy since. But had I not been in that aftercare, I didn't have any symptoms. I was feeling well. I think my cancer would have progressed beyond a reasonable amount, and I'd be in big trouble right now, or not here at all.
Thank you, Bill, very much. I want to also share with you another question that we've received, and I like it because it speaks, I think, deeply to the emotional side of colorectal cancer. And the question is, on your journey, did you ever feel alone? And it's no specific person that it's asking of, but I think it's a great question.
I'll answer if that's okay. Yeah. Given that I had been through this before, and you just like, you have it like, this cancer is out of my head, like it's done. That's how I thought. And having to come back, you start asking yourself why me's, and you do feel alone as universe has put this on me, and I am definitely a person who likes to sort of take care of myself and self-motivated and so on. And when we found CRAN, at first I was hesitant. I said, I don't need any help to figure this out. Nobody can understand. But the power that CRAN has brought to me, and with the rest of the participants of CRAN, it really brought me out of that loneliness. And also, it was so great to share stories together, and to feel that you're not alone, and other people have gone through this, and also to hear success stories, because we need to hear those. We need to hear that you're not alone and you can do this. So definitely, you feel very alone, and reaching out to an organization and having that support is priceless. So gay CRAN.
Thank you so much. Anna, does someone else want to answer that question as well? I think it's an important one. If not,
yeah.
Anna, sorry, would you like to?
Yeah, I was just going to say, if the one thing that I noticed being involved with CRAN is not only is the organization behind you and providing you with introductions to the best physicians wherever it is you live, advice on treatment options and all that stuff, sharing with others success stories certainly is motivating. But the one thing I really admire about the people who attend the psychosocial meetings that we have with CRAN to share with each other, what I do admire is that it's a demonstration that you're not alone, not only through the organization, but you see other people attending the meetings with their partners. And I really appreciate how much other people, caregivers, through their demonstration of their involvement with their partners and through us being able to observe it when we meet, that amount of love, I think, is life-giving, and it's a tremendous force behind people doing well and tolerating their treatment. And I don't know where else I would observe that, and I'm thankful that I am able to on a monthly basis.
Thanks very much, Bill. I'm really cognizant of time. So what I'd like to do is wrap up with kind of a lightning round. So 20 to 30 seconds at most, folks, of what's one takeaway for the healthcare providers who are in the audience that you would like to leave with them about your experience or about what maybe would have made your experience better. It's not about a blame game. It's so that people can learn from what you've been through. So remember, lightning round. I'm going to start with you, Andrew.
Okay, I guess the big takeaway I'd want for the medical community would be that if someone comes into your office, that it doesn't matter what age they are, it's the symptoms, it's what they're going through that matters. If it's an 80-year-old or a 29-year-old like I was, it's the symptoms, and treat based on that and refer based on that. And just for the patients quickly, or prospective patients, hope makes a big difference. You can get through it, you can do it, and never give up on yourself. Thanks.
Thanks, Andrew. I'm going to go next to Armina.
Thanks, Dawn. I would definitely echo what Andrew is saying, and I said that sort of in my opening remarks as well. I would ask for the medical professionals to, rather than, because, sometimes the logical conclusion is the right conclusion, but sometimes it's not. And I just ask that when a patient is coming to a healthcare professional with these symptoms that could point towards this disease, to just pause and think, okay, maybe is this something, is there enough here that we should explore this a bit more? And for patients, just back to sort of the loneliness question, obviously, cancer is a lonely road. And as a young patient with colorectal cancer, not being, well, prior to actually being connected with CCRAN, it was really, really hard to have someone to relate to and to help me wrap my head around dealing with this disease. But my advice would be that progress is slow, but progress can be made little by little. You will get through this, and you are not alone. Reach out. There are people out there who you can speak to. If there's anyone out there, you could even reach out to me. I'm happy to talk. Just know that you're not alone and that you will get through this.
Thank you, Armina. Quickly to Anna and then Bill. You can see our timer frantically counting down.
I will just quickly say, when I was diagnosed, my family doctor was great. She actually looked straight at me and she says, "I'm sorry, I feel like we failed you." So I really appreciated her honesty, and again, just really appreciated it. And then we moved on to resolution. So it was really good of her candor. So go ahead, Bill.
Sure. We need healthcare practitioners to dig deeper when they are working with young people, ask a few more questions, and order a few more tests to be sure to land on the correct diagnosis as soon as possible.
Thanks so much, Bill. And again, on behalf of myself and CRAN, I would just like to say thank you so much to all of you for sharing today. I know that the audience has learned a lot. I have, just from the few times that we've interacted. I am so thankful that all of you are here to talk with us today, and I wish you all the best.